Hello everyone, I am Anastasia Jerva. I welcome you all to the new session of Fundamental of Nursing. In today's session, we are going to deal with a very simple yet a very important topic, which is known as the healthcare teams. So as we all know that healthcare is a team effort. Each healthcare provider plays a special role in providing care to the patient. Some team members, such as doctors or technicians, helps to diagnose the disease, while other experts help to treat the diseases or helps to provide physical or emotional needs to the patient. So here, all the people who are involved in these healthcare teams plays a major role in helping the client attain a good health. So now let us move to the definition of healthcare team. Healthcare team consists of a group of people who will be coordinating their particular skill in order to provide care for the patient. The personals who will be involved in this particular team will depend upon the condition of the patient. Or we can say that this healthcare team will consist of a group of professionals who will be coordinating their particular skills in order to assist the patient or the family members in the hospital. Here, the personals who will be involved in this team will depend upon the need of the patient. The healthcare team members which we will look at today include the doctors, the physician assistants, the nurses, pharmacists, dentists, technologists, or also known as technicians, therapists and rehabilitation specialists, the emotional, social, and spiritual support providers, the administrative and the support staff, as well as the community health workers or the social workers. So let us discuss about the various roles which these healthcare members will be providing to the patient as well as to the family. The first one here is the physician. So what is the role of the physician? As we all know that the physician is responsible for diagnosing the disease as well as for providing the therapy for the patient who comes to the hospital and who is not well. So here, as soon as a ill patient comes to the hospital, it is the responsibility of the physician to diagnose the disease condition as well as to provide the various treatment modalities in order to improve his health. Here, a physician is a person who is legally authorized to practice medicine in particular jurisdiction. So as a doctor here, he have the rights or it is his responsibility to collect a detailed history of the patient. Here, as a doctor, he can collect the medical as well as the surgical history. He can also update the chart and the patient information in order to show the current findings and treatment which the patient is following. He can also order the nurses or the other health team professionals to conduct various tests to the patient, as well as he can also review the test results in order to get an idea if the person is having any abnormalities. A doctor can also recommend as well as design a treatment plan for the patient. He or she can also address any concerns or information as well as answer any questions that the patient or the family members wishes to know. He can also advise the patient as well as the family members about the various factors which they can adopt in order to improve their health, such as information regarding the various foods that can help improve their nutritional status, as well as about the various lifestyle modification which they can follow in order to improve their health. Some doctors, like surgeons, they can also operate the patient in order to treat certain disease or illness. Moving on to the next member, which is the physician assistant. So, who are these physician assistants? These physician assistants are the people who are also involved in the medical care team. Here, these people can be the surgeons, the doctor, the nurses, or any other healthcare professionals. These physician assistant, also known as the PA, it is their responsibility to provide the primary medical services to the people. As a PA, these people they have a wide range of services that they can provide, which can include taking comprehensive medical history, performing physical examinations such as head to toe examinations. They can also order as well as interpret various diagnostic tests which is performed. They can also coordinate or pass information about the patient to the other healthcare team members who are involved to treat the patient. They can prescribe medications to the patients as well as it is their duty to document and communicate the patient's information to whoever requires it. For example, it is the PA's duty to communicate the particular information which they have found out. Maybe it can be related to any diagnostic test which they have recently performed. They can also counsel as well as educate the patient as well as the family members about how to maintain their health as well as how to prevent the diseases. The next one is the nurse. As we all know that in a healthcare team, it is very important that nurses must be a part of it. And here it is not necessary that it should only include one or two, but there can be a number of nurses involved. They can also have a nursing team. This nursing team is nothing but a group of people who will be involved, who has the responsibilities of providing care and services to the patient. Each healthcare team will have a head nurse who will be responsible for delegating or dividing the duties to the nurses, as well as who will be responsible for making sure that these nurses provide the necessary care to the patients. An RN or a registered nurse can provide and coordinate patient care. He or she can record the patient's medical history and symptoms. They can administer patient's medication as well as treatment. They can also set up various plans which they can implement in order to provide care to the patient. It is their responsibility to also observe the patient as well as record their observation in order to communicate it to the doctors when they come for rounds. They can also consult and collaborate with the doctors or the various healthcare professionals who are involved in providing care to the patient. They also have the right to operate as well as monitor the medical equipment. They can also help to perform various diagnostic findings as well as analyze the results. They can provide health education to the patient as well as to the family members, and they can also act as a counselor whereby they can advise and provide emotional support to the patient as well as the family members. So, these are the various roles and responsibilities of a nurse. Moving on to the next one, which is the APRN, also known as the Advanced Practitioner Registered Nurse. Who are these nurses? These nurses are the ones who are specialized in the particular field. These nurses can be the nurse midwives or the nurse anesthetists. These nurses can coordinate patients' care. They can also provide primary as well as specialty health care. They take as well as record the person medical history as well as their symptoms. They can also perform various physical examinations as well as They also have the right to create plans in order to provide care for the patient. They can perform as well as order various diagnostic tests. They can also operate and monitor the various medical equipments. They can diagnose various problems as well as they also have the rights to analyze the test results and also make changes in the patient condition whereby they can alter the treatment plan as needed. They can provide medicines and treatment as well as they can also evaluate the patient response to these medicines or treatment which is being provided to them. They can also counsel and teach the patient about the various factors which they can adopt in order to maintain health and to prevent themselves from falling ill. Moving on to the next one, which is the dietitian. Here, a registered dietitian have a specialized nutritional as well as a medical training that helps them to determine a person's nutritional needs, and here these dietitians can plan a person's meal in and out of the hospital as requested by the physician. While planning meals for these patients, these dietitian will also consider the personal, cultural, as well as the religious food preference of the particular individual in order to make it more effective. However, this can vary from one person to the other because here there are certain disease conditions in which they have a very specific dietary allowances. For example, people who is suffering from diabetes needs to follow a diet which has a low sugar level. And also if a person is suffering from any kidney problems, he needs to follow a diet which consists of low potassium level. That's why here the dietitian will be planning a meal depending on the requirements of the patient. Here the dietitian can also advise them to avoid various foods which can impose a threat in their condition. The next one is the physiotherapist. Here, a physiotherapist is the one who will be providing assistance to a patient, especially to those who is having problems with their musculoskeletal system. These physical therapists will evaluate as well as treat the patients who are having difficulty in functioning. For example, they will help treating the patient who has difficulty in walking, changing position, or transferring from the bed to the chair. Because as we all see that these problems are quite common, especially when a person has been hospitalized and bedridden for a long duration of time. So what these physical therapists will first do is, first they will assess their strength, their coordination, their endurance, and then design a brief exercise hospitals which they can follow in order to improve their physical functioning so that they can perform their own things independently. Moving on to the next, which is the medical social worker. Here, what is the role of the social worker? These social workers are the ones who will be providing information, support, as well as education. So here, before a patient gets discharged from the hospital, these social workers will help them prepare for the discharge by identifying as well as arranging various health services which can be provided to them in their own home or in the community. These social workers will also coordinate with certain home care needs, such as they will be arranging a visiting nurse or a physiotherapist if needed, and they can also provide medical equipment such as wheelchair or hospital beds. These social workers can also assist the patient as well as the family members with conditions such as finances, accommodation, adoption, counseling, or any marital problems. So these social workers are the ones who will be working in order to benefit the patient as well as the family members. The next one is the occupational therapist. These occupational therapists are the ones who will be assisting the patient in order to perform their daily activities. These activities can include eating, bathing, using the toilet, grooming, etc., which we performed in our day-to-day life. So here, what these occupational therapists will do is they will be providing various strategies or devices which will help us to function independently. Moving on to the paramedical technologies. Here, this can include the laboratory technologies as well as radiological technologies. Here, the laboratory technologies can examine as well as study specimens such as the blood, the urine, the feces, as well as discharges from the wound, in which they could then provide a report which will help the physicians determine or diagnose the disease condition. Whereas the radiologic technologies will be assisting with wide range of X-ray procedure, which can range from a simple chest X-ray to a complicated fluoroscopy. With the use of these various radiological studies, this can help the physician to diagnose the disease condition of a patient. Moving on to the next one, which is the pharmacist. Here, the pharmacists are the ones who are specialized in how the drugs work and how they interact with each other. When we all go to the hospitals, we will obviously see the pharmacists which will be present in the pharmacy. Why? This is because these people will be helping in providing medications as well as they can also teach people on how to effectively as well as safely use the drugs which is being prescribed to them. If needed, these people can also teach or advise people regarding some foods which they should avoid in order to prevent the interaction with these drugs, or they can also teach patient on how to self-administer medication at home such as insulin. The next one is the inhalation therapist. These inhalation therapists, also known as the respiratory technologists, are the ones who are specialized in treating people suffering from various respiratory diseases or disorders. These therapists have a very good knowledge about the oxygen therapy devices, the intermittent positive pressure, breathing respirators, artificial mechanical ventilators, as well as the accessory devices which is used for inhalation. As I've said that these inhalation therapists are the ones who are specialized with dealing with people who are suffering from respiratory problems. So these people will be having a good knowledge regarding the oxygen therapy devices, the intermittent positive pressure, or the accessory devices which needs to be used for a patient in order to help them to reduce these respiratory problems. The next one is the psychologist. Here, the clinical psychologists constitute an important member of the healthcare team. Why? Because these psychologists are the ones who will be looking into the psychological functioning of the patient and will be planning various healthcare services that can be provided to them based on their condition. The next one here is the clergy. As we all know that the spiritual dimension of a patient comes into play more, especially when a person is ill. So these clergy plays a major role for those people who draw their spiritual strength from God and who believe that only God is the one who can save them. With the help of these clergy, the patients will be able to draw their spiritual strength and they will be able to cope with their illness successfully. So here we have come to the end of this topic whereby we have studied about the various roles of the various healthcare team members such as the role of a doctor, a nurse, a physician assistant, a clergy, a psychologist, an occupational therapist, a social worker, a physiotherapist, as well as a dietitian. I hope you guys have got a clear idea of the various roles and responsibilities which one needs to follow. I'm sure that when you guys will be starting your clinical postings, you will be getting a clearer idea of what are the roles and responsibilities of these particular health team members. And I'm sure with just one glance of this topic, again, you'll be able to remember it for your lifetime. So I hope you guys have understood this topic. We'll be meeting you guys in another session. Thank you.